think we're here today to try and inform as many veterans as we can. We're here with Dr. Bash.
Welcome, Radio Land, TV Land, and YouTube viewers and listeners. This is Dr. Craig Bash. I've been doing veterans medical opinions for 30 years, and I have dozens and dozens of these radio shows which we're going to publish on this YouTube channel, and number 1 through whatever. So thank you for listening, and here we go.
Tonight, our guest speakers will be Dr. Bash and Bill Kreger. Whenever they get here, they're running a little late, but they'll be along directly, and we'll get them going real good for y'all. If anyone has any questions or comments, feel free to call in. Our call-in number is 347-237-4819. Now, this call-in number, once again, is 347-237-4819. And then you hit number 1, and that'll put you in the queue with us. And when we see you come in the queue, we'll try to get you on the line here. 240, I think that's Dr. Bash.
Yep.
Yes, Dr. Bash.
Yep.
How you doing?
I'm
How
good,
you
I'm
doing
good.
today, Dr. Bash? Well, and that looks like Bill come in right behind you.
Yeah, here I come. Glad to be here.
Well, we're waiting on y'all. We wouldn't dare start without you. So we got them all prepped up and raring to go. Let's see. What would you want to talk about today, Dr. Bash?
Well, we were talking a little about maybe CUE and severance, when they cut benefits.
Oh,
Reductions.
when they that's bad. Yeah. That catches a lot of people off guard.
Yeah, I think there's a lot of effort to try and save budget money, and so we're getting a lot of reductions,
Yes.
It's swift to do it. So
most generally, a veteran gets worse, not better, but in some cases, possibly there could be improvement. It depends on circumstances, I guess.
Yeah. There's a particularly problematic when we're dealing with the evaluation of a service-connected disability, and the decision is made to reduce that evaluation. There's a long shopping list of tests and requirements that one must find before you are permitted to reduce a veteran's evaluation of disability. And what I've found over the years is that a significant portion of those reductions are made without consideration of the requisite regulatory requirements.
So we have.
Well, that may be so, but when don't they have to give the veteran so much notice before they actually reduce their comp or pension, whatever it is?
Yes, you're exactly right. And the governing regulation for that is 38 CFR 3.105E. And that Congress basically created that rule to allow a veteran time to adjust his lifestyle and his budget before suffering the loss of that income. And that's why the regulation provides now 60 days. We were recently asked to review a case for a veteran who had suffered a reduction, and the first thing I noticed was that they effectuated the reduction 59 days after the decision to reduce. Well, I'm sorry, but 59 days is not 60. So in order to comply with the regulation, if they do the right thing, VA must, for that veteran, immediately restore his evaluation. And then, after they pass all the other tests, they may again propose to reduce in the future if they want to continue to try to do that. But because they missed that 60-day period, that reduction is what's called under the law void ad initio, meaning from the beginning. And so and the court has consistently held that whenever VA errs in a reduction, the remedy is immediate restoration effective from the date of the reduction. That's what we want people to know.
Give him a couple details about this guy. This is the brain tumor patient, right?
Yes, one of our brain tumor patients. And
my
VA...
My point is it's particularly egregious because a brain tumor patient, his brain doesn't work normally properly, you know. So for them to reduce him incorrectly is really bad because he can't protect himself against the system that's taking advantage of him.
Yeah.
Basically.
Well, that's absolutely right. Yeah.
Yeah, his impairment itself renders him less able to defend his compensation, and it's just unforgivable.
Exactly. That's my point. Yeah. So the rules are pretty clear. It's 60 days, and then this guy, I don't think they gave him very good. Did they give him notice enough, Bill? I can't remember if they gave him the right paperwork either. Did they notify him as well as they should have?
Yeah. Well, now we have 2 brain tumor patients that we're working with right now, but
we can mix them up a little bit if you want. Yeah,
yeah, mixes me up a little.
Yeah.
But the one I'm thinking of, yes, he was reduced with a mere 59-day notice, and now he's filed his notice of disagreement, and along with your medical evaluation to help them understand the correct way to evaluate the disability. And hopefully that will be promptly restored.
And the second guy, the second guy, they didn't give him the notice, right, Bill? They didn't give him the right paperwork or something.
Well, what I'm observing in the second case, they initially granted service connection for a tumor, but mistakenly adjudicated it as if it were a benign tumor.
Right.
And it wasn't. It was a malignant tumor. Well, last January, VA recognized their error, clear and unmistakable error, and they granted him a total evaluation from the day after service until 2 years after he finished his radiation therapy, which was correct. However, they then assigned, in the same rating decision, the minimum 30% evaluation for residuals of brain tumor. Well, the minimum evaluation is only payable if you have no other disabilities manifesting as a result. So that wasn't right. But they also missed the date of reduction. They made it in the middle of the month instead of the first of the month. In other words, reductions are all end of month. And so when they reduced him in the middle of 1 month, had they correctly carried out to the end of the month, it would have been another month, 1 month compensation at 100%. So they got that wrong as well. Now, we've been reviewing treatment records, and we've been discussing what the possibilities are, and it looks like the veteran has a myriad of complications from that brain tumor and surgery and radiation, and we're hopeful that we'll be able to be certain he has a total and permanent evaluation after we finish our work. It's now pending, waiting for a hearing before BVA. And so our evidence will be available to him before the hearing.
So both these cases are, there's a problem with timing, right? They're trying to rush to reduce these guys without giving them adequate notification and timing. It's kind of seem like
Yeah, I would say historically, my observation is that, and this, I mean for decades, the raters are in such a hurry to meet their quota that they are less thorough than they need to be when effectuating a reduction. The manual, and I always go back to the manual first because the compensation service at VA, the central office, is committed to the premise to put everything in one place so that it'll be easier for the raters to find. So everything that's a substantive rule is being placed in the manual, the Adjudications Procedures Manual called M21. And I'm going to rattle this off just for technical purposes. In M21, 348D2A. Now, you can just Google reductions and it'll come up for you. It explains there that you must apply the provisions of 38 CFR 3.344. Now, I know this is all sounding very technical, but basically we're just saying the manual and the regulation and VA General Counsel present opinions are all lined up. They're all consistent with one another, and they're correct. Okay? And the essence of this regulation is what I call the 5-year rule. If you've had a disability evaluation in place for 5 years, then 3.344 says there are a lot of tests you have to make before you reduce a veteran's evaluation. The preamble of this regulation says, and I quote, that the rating should reflect the greatest degree of stability of disability evaluations. So the goal is to be stable. The VA's declaration here in the regulation is that evaluations should remain relatively stable. They should not have big fluctuations. They should not be willy-nilly raised or lowered. There should be some stability in the evaluation. It also says that if you are proposing to make a reduction based on a VA examination, that examination must be as full and complete as the one that established the evaluation in the first place, or it will not be used. And that was upheld by the court as well. Secondly, if the particular disability in question is subject to temporary or episodic improvement, there's plenty of, we can think of a lot of those, can't we? How about the discs in your back? You have exacerbations and remission. That's a classic. The regulation provides that when these are subject to temporary or episodic improvement, they will not be reduced on any one examination. You have to have 2 or more examinations before you reduce something that's subject to episodic changes. Now, what are the exceptions? One is if you can demonstrate there has been material improvement. In other words, just not a minor improvement, but a significant material improvement. And number 2, you must demonstrate that that improvement has been sustained. So it's been there. It's not just on and off, but it's sustained. It's a continuous level. And then third, if you find that there's material improvement, and if you find sustained improvement, then you must find also that it's maintained under the ordinary conditions of life. In other words, if I'm a carpenter and I've taken off work for a couple of weeks before my VA exam, review exam, and now my back is better because I've been resting at home, okay, then you can't use that examination to evaluate the disability because you have to show it's maintained under conditions of life. And it actually contains this phrase, not following prolonged rest or bed rest. Okay? That's the intent of the regulations. It also points to mental illness and psychiatric conditions, and you have to be certain that these are not temporary remissions. And so,
hey, Bill, I want to break a couple of those.
Question?
I want to break a couple of those things down. So, what if a guy, like one of our two patients, probably has less than 5 years of disability? What applies in that situation?
Well, this regulation only applies to disability evaluations that have been in place for 5 or more years. Okay.
Yeah.
Now, if it's less than that, okay, we don't have to jump through all of those hoops. However, still, an argument can be made that, of course, now the court has a long jurisprudence on the question of examination reports. And it's sort of coalesced in Nieves-Rodriguez v. Peek. You can find that at 22 VEDAP 295. It was decided in 2008. And basically the court here is pointing out the legitimate reasons for favoring one opinion over another, or favoring one exam over another, and what factors consider, like the expertise of the expert witness, the factual predicates that they use to determine that opinion, the reasoning, and this is most important. Can we understand the reason for the opinion? And that reason is really pivotal. Why? Okay, if one doctor says this veteran can bend over and touch his toes, and the other one says he can only bend 30 degrees, why are they different? We have to be able to understand why before we decide which one of those we're going to use.
So, Bill, in that period between 0 years and 5 years, does that mean that the rating code can't change, or the percent can't change, or what does it mean by the disability? It has to be in place.
I was quoting from 3.344, which was saying, that the intent of evaluating the disability is to maintain the greatest degree of stability in the evaluation.
Yeah.
Now, with reductions, as with any evaluation, the court has made it very clear that all of the rating schedule, including those preamble portions, are required to be considered, like 4.1, 4.2, and especially 4.10. 4.10, and here's where you see a consistency in the rating schedule. If you look at 3.344 and you look at the words of 4.10, they both contain this phrase, under ordinary conditions of life. Okay? So, you see, when you're evaluating the disability, and let's again go back to the back example, when you're evaluating the back, the frank number of degrees on the day of the examination is not determinative. 4.10 makes clear that that evaluation is to reflect the degree of disability on use. What is the functional impairment under the ordinary conditions of life and employment? And so the intent is not to evaluate the postman's back in the morning. The intent is to evaluate it after he's been delivering mail all day. Then we measure and evaluate the back. That is the intent. Fall a little short sometimes, I'm afraid.
Yeah, because you got to take the whole clinical situation, in context. But like in that 0 to 5 year period when the rule doesn't apply so much, it's still based on the exams. It's not so concrete, but it's still based on the quality of the exam and who does them and factual rationale, right?
It is actually predicated on the entire record. And the duty of the rater is to consider, weigh, and evaluate all of the evidence, including the veteran's description of symptoms, including records of care, in addition to examinations and treatment records.
Yeah.
And one of the things that is still to this day, I took a look recently at 2018 court decisions discussing where the court was invited to review a reduction in evaluation. And there has been no new precedent in the court this year. All of the decisions on this topic that I could find were all single judge opinions saying, well, the law in this circumstance is well settled and there's no new precedent to be established. And they reflect back on those very same opinions that most of us are supposed to be familiar with over the decades. And so, the problem is the speed of the adjudications and the automation of the adjudications. Because if you are trained to point and click, make the entries and have transpose the data off the exam into the software and then let the software evaluate the disability, you're going to come up shy. You're going to come up shy because you don't know what other factors are not in that software that should be.
So let's go to that two.
Mm-hmm.
Let's go to that two exams for a second, because I mean most mm-hmm. illnesses have some wax and waning aspect to them, and probably, I mean, in my experience with reductions, I can't remember hardly ever seeing two exams. Did you see two exams when you did yours, or is that another one of those software glitches where they don't really pay attention to that?
I would say less often. However, a VA treatment record may be used as an exam if it provides relevant data. For example, if we're evaluating hypertension and we see blood pressure readings in the treatment record, and then we have a current examination, and there's a disparity there, we have to understand why before we accept what's on the examination as determinative on what the evaluation should be. Does that make sense?
Yeah. Another aspect you mentioned was this idea of equal exams or same quality. That's how about in your experience? Because we see sometimes a lot of nurse practitioners and PAs now rolling in doing exams compared to maybe a physician exam. So not just based on credentials, but also based on the quality. And what's your experience with that, Bill?
Yes, well, if I get an opinion from a neurosurgeon that relates a condition to service, and I have an opinion from a VA examiner who is not a neurosurgeon, but is perhaps a nurse practitioner, Then I have to look at the reasoning, and I have to decide which one of those to agree with. Now, if the nurse practitioner points out to something in the record that is dispositive, like, for example, perhaps an injury to the back occurred during a period of bad service time, while AWOL or while confined, where the disability in question would not be subject to service connection. And the neurosurgeon wasn't aware that it was incurred during a period of disqualifying service, then I would be siding with the nurse practitioner. But if the nurse practitioner, and I actually had a case like this, a nurse practitioner said, it's not related to service because he got a workers' compensation settlement after service. The neurosurgeon who operated on that veteran's back opined that what he found represented progression of the original injury in service. And so I went with the neurosurgeon. He was inside the guy's back. He knew it was in there.
We have a caller in here. Caller, let's see, 816 number, area code. You have a question or comment?
Yes, I do. I would like to ask the gentleman, what do you do when the VA has set on your records, basically your entire adult life, and refused to release those to give you the evidence to prove your claim?
Oh my goodness.
Let me give you an example if you don't mind.
Sure.
Okay. Well, I think are you getting some feedback? Because I was looking at my tablet.
Yeah, it's a little bit of odd sound, but I can understand you. Go ahead. I'll repeat it for the audience to make sure.
Okay, I'm just going to try to turn it off, see if that makes any difference.
Thank you all for listening. That ends this show. And now I'm going to zoom off.